Hey there. Welcome to the Pelvis Project podcast. I'm Megan.
And I'm Roxy. We're two pelvic health experts brought together by passion for our careers, entrepreneurship, motherhood, and the desire for intentional relationships.
Join us in our mission to spread pelvic floor awareness and start conversations surrounding the truth behind genuine health, imperfect wellness, and joyfully navigating life. We are so glad you are here with us.
Let's start the conversation. Hey, Megan.
Good morning. Notice, everybody, I said good morning. Welcome back.
We are doing this in the morning.
It is not 10 o'clock at night tonight. So we're going to get this started and start with our Tell Us Something Good. Roxy, what's been going on?
Oh, you know what? The sun's shining and we've been outside and I think spring is in the air and that brings just happiness. And I think I needed a good dose of sunshine and outdoors, and I don't have anything super specific, but that has been very, very refreshing to be able to go do things after work outside instead of it being snowpocalypse and frigid and all the things.
I agree. I think I feel the same way. Just the sun and the warmth has definitely given everybody, I think, a sense of relief and like, okay, we're ready to continue to carry on. But I do have something good. I guess I could talk about it afterwards. But my son, who is 10, is getting baptized on Friday. So that hasn't happened yet, but we recorded. He went to our church this last weekend and they do like a pre-recording of the testimony. And so he went and did that. And he was pretty nervous ahead of time. And afterwards was so excited to tell me about it that it only took him 2 tries. And so I'm just really proud of him because this is something he has talked about and wanted to do, but was nervous to do it and nervous to obviously be on the big screen and nervous to go under the water, like so many different aspects of it. So, and I know he's still nervous. And so I'm proud of him for just embracing that and doing it anyway, because that's kind of the motto in our household is just, you know what, it's uncomfortable and it's scary, but we're going to do it anyway.
I love that. That's
yes.
Good for Owen. He's grown up.
He is. He is. All right. Well, we are going to try to give you a little short, quick, powerful pelvic episode today on pooping and why it shouldn't be a struggle. There are so many myths about our bowel movements, and we hear people come into our clinics all the time that, they come in for something else and we ask them the bowel questions and they say like, oh, I go once a week and that's just me. That's the way I've always been. Or, I go every 3 days, but I'm not constipated, stuff like that. So I definitely think this is a great topic because this is probably one area that people don't realize where pelvic floor dysfunction could be going on. And always there's, of course, areas that need to be screened, like, GI stuff and that sort of thing. But the mechanical piece that can happen within the pelvic floor that influences our ability to have bowel movements is super important to know. So here we go. And we are going to start off with a question. So have you ever dreaded going to the bathroom because it feels like a battle? We are going to start with that.
I can't say that I've ever struggled with constipation, but I have kind of a funny story right now. My little 2-year-old nephew is very constipated and we've been working on all the things, but he dreads it. You can see I just think that's the epitome of what like everyone that's constipated is going through is like, oh, I feel the urge and this is going to be bad. And you can just see kind of the dread and the terror on his face of like, oh, no. I don't want this to happen. I don't want to do it. And not that that's a funny story. It's actually kind of sad, but it is just like navigating constipation of a 2-year-old. Yep. Like you can't really rationalize with them. You've got to, figure out all the tips and tricks to get them to go to the bathroom and then not have it turn into a habit where it's like holding because you're nervous about it. And I'm not saying this to be like proud of myself, but that's not a struggle I've ever had.
Right. And I think that, I've had times in my life where obviously I'm like, when I was pregnant and stuff like that, where I was constipated. But exactly to your point, like to me, that feeling of like dreading to go poop because it might hurt or something, I haven't necessarily experienced that. And I know that you and I both see a handful of kiddos, and I can't push this enough of if you have a small child and they're constipated, like address it now. This is the time to address it. And if you're feeling lost in what to do, a pelvic floor therapist that is familiar with treating kids is a really great option because there are things that can be done besides just like, oh, take Miralax. Because if it has been painful, their rational brain, like as adults, we're like, okay, this hurts, but we know we need to go. Kiddos will straight up be like, oh, I'm not doing that. And they'll withhold. And it just becomes at that point something even more, perhaps like encoparesis, which is, like there's bowel leakage, there's bowel coming around the constipation. And so it goes down a road that is harder to come back from. You can, it's just tough.
I would just piggyback on that though and say, I don't know how many times then in the clinic, an adult has come in with urinary issues or prolapse or whatever it is. And from the intake paperwork, they've said, I didn't realize that I must have some trouble with my bowel movements too. And Megan and I know that then that's a huge problem, right? We're going to work on that and we'll get into that. But yeah, I think then when it starts young, the problem is then you don't know a normal. You don't realize how dysfunctional your body is because that's all you've ever known. So just another plug of like, we got to get this taken care of. We need to be talking about what's normal and what's not normal so that people who don't know any different start to realize, oh, life could be better.
Yeah, exactly. I know. Cause man, you should be able to go have a bowel movement and it'd be great. Funny story. We'll get to the point here, people. But when I was in PT school, one of my graduations, my dad had a bowel obstruction. His colon tied a knot on itself, and so he had to have surgery. So they did surgery. It didn't go great after, and so he had to have an ostomy bag for a little bit. And so, if you're not familiar with an ostomy bag, it's an external, like they bring the attaches, and so the bowel goes into this bag. And oh my gosh, my dad hated it. Like it was such a, of course, like that's so hard to go from like normal to having to deal with this. And so anyway, he had it temporarily and then it got reversed. And so he healed, but in that he had like his body had to kind of relearn like how to have a bowel movement. And so once it did, like he is all over the fact that like he is on top of his bowel movements. And so recently he was in the hospital. And obviously he had pain meds, different things, and it got him backed up again. And he was like so committed to figuring out how to go. And then now since then, I just talked to him yesterday and I was like, what are you doing? He's like, I'll call you back. You know what I'm doing. Like, and he was so proud. He's like, I can't quit laughing because he was just so glad that like he is just so relieved that his body can have a bowel movement. So anyway, we love that. And it's often a topic of conversation at our house. So, okay, well, let's move into this. So why this matters. That's where we're going to go to next. So why this matters. So normal pooping shouldn't require straining, breath holding, or 20 minutes. Roxy, do you have anything to say to that?
I think there's just a good differentiation between the bladder and basically the colon or the rectum is that the bladder is supposed to store and the rectum is not supposed to store. So when we feel that urge, that should tell us there's a bowel there and we should be able to go and evacuate that normally. And the reason it's called a bowel movement is because the intestines or the colon and the rectum move. There's a peristalsis. It moves it out. So we shouldn't have to strain. And so I think just even understanding some of those the basic language and the terminology and the anatomy of it's just supposed to go. It's just supposed to move smoothly through there. And so if it's not, then that's problematic.
Yeah. Well, and to that point too, as Roxy just mentioned, the bladder is meant to store and the rectum is not. That's why, for example, you have diarrhea and like you have to go right then, like you can hardly hold it back. The bowel is not meant to hold liquid. It's not meant to just sit there and hold it. Body's got a sampling reflex. It's like, okay, we got to like, the sampling reflex is going to tell you like, okay, is this like going to be gas? Is this going to be diarrhea? All that kind of stuff. But with that being said, you're not meant to hold back your bowel. And so when you're maybe in a workplace or kids are at school or in certain situations where you just are kind of training yourself to hold it all day long, isn't the healthiest thing for our bowels. So then we can end up leading to straining. But some other things with this, why this matters. So constipation is a major stressor on the pelvic floor. So like Roxy mentioned, in the pelvis, how the bladder's in front, and then we have the uterus behind that if you have a uterus. If you're a male, you don't have that. And if you've had a hysterectomy. And then behind that is the rectum. If we have this constipation, then there's that bulking in the bowel behind everything, and it pushes into the organs in front of it. And so then it's just causing more pressure in the pelvic floor. Sorry, more pressure on those organs, more pressure in the pelvic floor. So those pelvic floor muscles have to strain and work harder. And then the other piece of that is chronic pushing can lead to prolapse, hemorrhoids, and even pelvic floor dysfunction. So let's talk a little bit more about that, of just that straining. There's one muscle called the puborectalis, and it's a muscle that comes from the pubic bone, and it slingshots around the back of the rectum. And so when that muscle is tight, it causes an increase in the angle in which the bowel comes down. And I wish we could see a video of this right now, but that's where, if your pelvic floor has some dysfunction in it, and it could be chicken or the egg, we're not going to go into why that could be there, but that muscle, if it has become to a point where it cannot release or lengthen, that can cause some issues with constipation because it's causing that angle to be tighter. And this is the same muscle that you see in the images for like squatty potty, how you put your feet up on the stool and it puts your pelvic floor in a better position and alignment to have a bowel movement. It shows that the muscle that is shown in that video is that puborectalis muscle. We don't think about how pelvic floor muscles maybe not being able to lengthen or being tense could play a role in us being able to have a bowel movement. Same thing with like the anal sphincter muscles. There's a lot of times we see some dysregulation in being able to release the anus muscle. When you go to bear down, that muscle contracts versus relaxing. And that can cause kind of this dysinergia between, what should be happening. And then that can also lead to straining. So Roxy, anything else with that?
Yeah, I think just really stepping back then from that and thinking about when pressure comes down, our body, pressure is pressure. Our body and those muscles don't know if this pressure is from you coughing, or this pressure is from you lifting, or this pressure is from you trying to get your bowel movement out. So the default is that when pressure comes down, usually we want to hold things in. So when we cough, we don't want to poop our pants or pee our pants, right? Or if we lift, we don't want to do that either. So the default, our body's created that if the pelvic floor is working correctly, when that pressure comes down, then those muscles tighten up. If over and over again, though, you put pressure down on those muscles and they tighten up, and then you force that bowel movement out, then they start to become really confused. And they say, well, when pressure comes out, are we supposed to hold or are we supposed to let that out? And then we start to see then they either grip tighter and they resist more, and then it's even harder to have a natural bowel movement, or they start to be delayed because they're confused and they say, well, is this the time that we let go, or is this the time that we hold harder? And then we have leakage, worse. I think just understanding that's why we don't want people to strain. That's why we don't want to have to push really hard, because that pressure down should be telling the pelvic floor to resist up and not let things out. And so that gets really confusing for those muscles. And then we have just a confused bunch of pelvic floor muscles that don't work well in any situation. Then they don't hold well and they don't release well. And then that's a problem, because then they're not doing anything like they're supposed to.
Yeah. Yeah. It's so fascinating the way that the systems can just get miscoordinated, and it can be corrected with a little bit of training. Okay. So signs something is off is these are things that you should think about. Like you're straining to go. You're going less than 3 times a week. You're feeling incomplete after you empty, and you're needing kind of like weird positions and tricks, potentially like leaning like way forward or way back to be able to go to the bathroom or to have a bowel movement. So those are all things to think about. The other thing I would say is if you are going maybe every day, but let's say it's a very small amount. Let's say they're kind of like more of those little like pebble bowel movements, kind of like rabbits, those are things where you're like, okay, well, I'm going every day. But if that's what that looks like, that's still a sign of constipation.
I would also add pain to that. Like if you're
totally
having a bowel movement and there's pain, bowel movement shouldn't be painful. It should be relieving.
Exactly. Yeah. And you also shouldn't have pain, even if you don't have pain during, let's say afterwards you end up having some sort of like spasm or rectal pain, again, that's not normal and that needs to be addressed. Obviously you want to mention it to your doctor, but then a pelvic floor therapist is the correct avenue to go. And obviously you got to clear and make sure there's nothing scary going on. But after that, like we're the people to go to for that. Okay, our next little area that we're going to go into is the pelvic floor connection, which we kind of already talked about that, but just a couple of things here. So pelvic floor muscles help relax to allow easy bowel movements. If too tight or uncoordinated, stool won't pass easily. So this is kind of what we talked about before. And this is common in postpartum or during perimenopause or with stress. You can see changes that happen in your bowel movements, which I know we're all sitting here probably being like, yes, that is exactly right. Like during stress, some people get constipated. Some people have diarrhea. During times of our cycle, our bowels change. Obviously during postpartum, goodness, you just had a stretch injury to your pelvic floor muscles and possibly tearing, that sort of thing. And now, oh my goodness, you have to go have a bowel movement. So that can be a very scary kind of like first thing to do after you've had a baby. And then with perimenopause, we just see changes happen, like cycles changing, hormones are changing, that sort of thing. And so these are all different areas where you might see changes happen in that pelvic floor connection. Any others off the top of your head, Rox, that
well, you hinted at one earlier with your dad, just medication changes can really throw that off. And then I would also I think some GI, when there's GI influence of like if you have digestive issues or sensitivities or things like that, then I think we can definitely see where the stool's going to maybe change more, but then the body responds to that. If you have abdominal pain or cramping from digestion, I feel like I see a lot of that where it's, I know if I eat ice cream or whatever, then my stomach's going to hurt and then I'm just going to have problems or something. That's kind of another thing I'm just thinking of here that can throw all that off.
And I think to that also, which could be a whole episode itself, but as you said, as you're dealing with GI issues, there are different conditions and different reasons, why we have GI stuff going on. But if you've been dealing with something along those lines for a while, we know that there's going to be inflammation in that abdominal wall. And potentially at that point, we can have adhesions build that we can feel when we're doing abdominal work. And if we have adhesions with the bowel, then potentially, we're not going to have maybe as good movement happen. I think that's just something to consider too. If you're listening and you're like, oh, wow, I have a close friend that has Crohn's. And we started doing some abdominal work to help manage some of the discomfort. And, what we realized once I started my hands on her abdomen, we were like, oh my goodness, like it was just so eye-opening to some areas of discomfort that then felt better after we released that area, the diaphragm, all of that stuff. So it really is kind of cool. And that's where in the practices that Roxy and I have, we are going to, if somebody comes in with constipation, it's not just the pelvic floor that we're going to be talking about. We really do, again, have to look at all the different pillars of health, the abdomen, the diaphragm, the thoracic spine, all of it. So really, again, just love what we do because it's so fascinating. So here we go. Quick tips for pooping better. Use a footstool, which we've already mentioned the squatty potty. That's very helpful. You really should have one. We want to make sure that you're exhaling while you're bearing down instead of holding your breath. So that's probably the big, you don't want to close your glottis and turn purple. We are exhaling our breath, belly breathing to relax the pelvic floor. So again, that's something that we work on a lot here is the proper breath and how the diaphragm and the pelvic floor work together in synergy and how our breath can allow the pelvic floor to release. And so we need the release in the pelvic floor to happen in order to have a bowel movement move on through. So belly breathing and then daily fiber and hydration and don't ignore the urge to go. So footstool, exhale, don't hold your breath, belly breathing to relax your pelvic floor. Look at your nutrition, your fiber, make sure we're getting hydrated and don't ignore the urge to go to the bathroom. Please do not hold it all day long.
And I would just encourage if you notice some of these, one or any of these are your normal or would be different than your normal, I should say, and you start using those, there's a lot of power in going through the motions, even if the first time you try it isn't perfect and successful. a lot of times we have to remind and we have to reteach our body the motions it's supposed to go through. And then it starts to adopt that habit. Because I feel like I have several patients that are like, well, I've tried it, but nothing's really changed yet. Sometimes people are like, oh, I tried it and made a difference, right? But there's a lot of power in just continuing and giving your body the correct repetition so that we lay a good foundation, lay a good groundwork, and we're teaching our body what our expectation is and how it's supposed to work.
Yeah, love it. All right, so here we go. Pooping should be easy, folks. If it's not, your pelvic floor might need a little bit of TLC. And if you're like, yep, that's me. Obviously, if you're in Kansas, we would encourage you to reach out to Roxy and I, come in and see us. And if you're not, we always can do virtual consults. And this is something that is a good can be easily done virtually to have a good conversation about some strategies and being able to teach over the computer. So if this sounds like you and you're interested in getting some help, please reach out to us. We'd be happy to help you. Or if you have any questions regarding anything we talked about today, we just encourage you to send us a direct message through Instagram, which is at The Pelvis Project. There's a period between each word. And we'd be happy to chat with you. Or again, our individual handles, Roxy is at Good Life Pelvic Health, and I am at Kansas Pelvic Health. We'll have that in the show notes, and we'd be happy to talk to you. Roxy, anything else before we go?
Nope. Happy pooping.
Okay. Happy pooping, everyone. Let us know if you've got questions, and we'll talk to you soon. Thank you so much for joining us this week on the Pelvis Project podcast. Help us continue the conversation by liking and sharing this episode with friends. And if you really want to do us a solid, leave us a review. If you'd like to follow us on social, check out the show notes for links. And remember, this week, take a deep breath and relax your pelvic floor.